against cancer, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं.
Detect early, treat timely, eradicate totally. A global cancer awareness drive by Grace Cancer Foundation.
You gotta hit cancer, a big blow. It's time to wipe off this foe. Let's run round and show. Let's get set and go. जिस आने जिस तूफान का डर है हर दिल में, उस कैंसर को जड़ से मिटा दे हम मिलके. चलो लड़ते हैं, चलो बढ़ते हैं, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. Fight against cancer, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. कैंसर को रोके, खुशहाली फैलाए, एक उम्मीद फिर से हर दिल में जगाए. चलो लड़ते हैं, चलो बढ़ते हैं, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. Fight against cancer, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं.
Detect early, treat timely, eradicate totally. A global cancer awareness drive by Grace Cancer Foundation.
You gotta hit cancer, a big blow. It's time to wipe off this foe. Let's run round and show.
This
Let's
program
get
starts
set
in 2
and
minutes.
go. जिस आने जिस तूफान का डर है हर दिल में, उस कैंसर को जड़ से मिटा दे हम मिलके. चलो लड़ते हैं, चलो बढ़ते हैं, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. Fight against cancer, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. कैंसर को रोके, खुशहाली फैलाए, एक उम्मीद फिर से हर दिल में जगाए. चलो लड़ते हैं, चलो बढ़ते हैं, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. Fight against cancer, चलो दौड़ते हैं. Let's run together,
This
चलो
program starts in 1
दौड़ते
minute.
हैं.
Detect early, treat timely, eradicate totally. A global cancer awareness drive by Grace Cancer Foundation.
You gotta hit cancer, a big blow. It's time to wipe off this foe. Let's run round and show. Let's get set and go. जिस आने जिस तूफान का डर है हर दिल में, उस कैंसर को जड़ से मिटा दे हम मिलके. चलो लड़ते हैं, चलो बढ़ते हैं, चलो दौड़ते हैं.
This program starts now.
Hello and welcome to this program. We thank you for joining us. This is a very vital program and the topic is cancer screening, the importance of early detection. We have a panel of experts here, but I just wanted to say one word. And that is, these are statistics published by the World Health Organization. Most alarming statistics belong to cancer than anything else. Among the worst predictions is the most grim and frightening prediction that 1 in 10 persons will have a tryst with the scourge of cancer. And I'm talking about our country, India alone. What an alarming prediction, that is not at all good. And so it is so wonderful that Grace Cancer Foundation is having this webinar on the topic of cancer screening and the importance of early detection. We have a panel of expert oncologists with us. I just want to very briefly introduce them. This is not a detailed introduction, but such eminent people, eminent oncologists. Dr. Rupinder Singh. He's a consultant surgical oncologist and laparoscopic surgeon at Varyam Singh Hospital, Yamunanagar in NCR. And he's a visiting surgical oncologist at Chandigarh and New Delhi multi-speciality hospitals. A warm welcome to you, Dr. Rupinder Singh. Thank you so much for sparing this time on a Sunday evening for you, for being here and sharing your knowledge on this very important topic. We have Dr. Pratima. Dr. Pratima is a leading breast oncosurgeon, an oncoplastic surgeon working with Apollo hospitals. As the other panelists, she is a humble and a sincere, a dedicated person, willing and almost eager to share her knowledge on this vital topic. And then we have Dr. Chinnababu Sunkavalli. Dr. Chinnababu Sunkavalli, he's a robotic surgical oncologist with Apollo hospitals. And he's also the founder and the head of Grace Cancer Foundation. And Grace Cancer Foundation is behind this global virtual run, which is coming up. We're in the run up to the global virtual run, are these series of webinars. And the Grace Cancer Run 2020 coming up on 10th October. Dr. Chinobabu is the founder and head of Grace Cancer Foundation. Thank you so much, three of you, for being here, sparing your valuable time. It speaks volumes about your desire to make a difference in society and to really help us to deal with this terrible word. Growing up, this was the most frightening word, I assure you, because I lost both my father and my father-in-law to cancer. Was the most frightening word. It's a yeoman service that you're doing, talking to us about cancer screening, early prevention and detection. Friends, we'll be going into a presentation now, but you'll be able to put up your questions. But first, I would just hand it over to Dr. Pratima for her to take us through a presentation. And I request you be all agog as you listen to this valuable information being shared by Dr. Pratima. Dr. Pratima, over to you.
Hello, viewers. Today, I'm actually excited to talk about this topic because usually, whenever we talk about cancer, like Mr. Pramod had just mentioned, it is always a very grave diagnosis, and people feel very hopeless and helpless to really, and they feel like it's a very fatalistic feeling. But today, I really want to talk about cancer in a more positive note, and kind of taking some control into our own hands and talking about ways we can prevent it, ways we can increase awareness so people are more apt to doing going for screening, and also being more aware of the symptoms so we go and get appropriate help at the right time, which will ultimately lead to us diagnosing cancer early, which will really improve our outcomes. And if you really catch cancers, especially certain cancers, very early, 1/3 of them can get cured, and 1/3 of them will have a very good life afterwards. So definitely, this really makes a difference, and that's why I'm excited to talk about this topic today. And I'm going to mainly be talking about cancers that affect women. The commonest women-related cancer that we all know, it's actually the number one cancer in the country right now is breast cancer, especially in urban cities. And next comes cervical cancer, which is it's more prevalent in the more in the lower socioeconomic areas, and also more in the rural areas. And this is actually a preventable cancer, and we'll talk a little bit more about it. And then I'll also briefly talk about ovarian cancer, which is the commonest gynecological cancer, second to cervical cancer. So talking about screening, so breast cancer screening for average risk women is actually, we recommend annual mammography between ages 40 and 55, and after 55, once in 2 years. And also, a lot of times people commonly ask a question, how long do we continue mammography? Usually it depends on, now our life expectancy has significantly improved. And we really would say, if you're having a life expectancy of 10 years, then you should continue mammography, because breast cancer is very common in the elderly women, like prostate cancer is very common in elderly men. And mammography, briefly, we are talking about, there's a lot of negativity around mammography, but I would like to say and emphasize, in the 1970s, when mammography came in, there was a 30% improvement in, the survival rates had improved because of mammography, because of the early detection of breast cancer. Mammography works. It is a single tool that has really showed a difference in survival rates because of early detection. So mammography works. Yes, it has its negative points, because it doesn't pick up all cancers, but it is definitely effective. The most important thing about mammography, it picks up calcifications that other imaging, like a physical examination or an ultrasound wouldn't pick up. And this really helps us catch cancer and certain pre-malignant conditions that can really have a benefit for the patient. And also, there's always a fear about the radiation. The dose is very less, and with the newer machinery, the dose is been even more decreased. And so the radiation that you'd get from a mammogram is about what we would receive without having anything, just by living over 6 weeks. So monthly self-breast examinations are very, very important. Yes, they have never been really proven to save lives, but they're really important because a woman should be aware of how her breast feels. So after age 20, we would strongly recommend a woman. This is really available in every online. You just have to have the best time to really examine your breast is about 5 to 6 days after your period, and because that's when your breasts are less tender and less lumpy. And it's important to be aware. You have to do this, because then when you see a slight change, then you can get the appropriate help necessary. Cervical cancer screening is something, we don't regularly go to for gynecological examinations. So this is something that I really encourage women to make it a part of their routine. Women after 21 should definitely start a continue pap test every 3 years, because cervical cancer is extremely preventable. It really can be picked up early and can have a huge benefit if you don't allow it to go into stage 3 and 4 disease, because outcomes are really bad at that point. So at between 21 and 29 years of age, we recommend a pap test every 3 years. After 30, you can continue taking them every 3 years, or you can also do an HPV test. That is, you test if you're infected by the virus or not every 5 years. You'd continue this on till 65 years of age. And then what happens is, after 65, you're like, do I really need to continue? You will have to continue. If you had a history of some abnormal pap smears. But if you did not have a pap smear that was positive for 10 years, then you can probably stop. And another important thing to know is, even if you've had a hysterectomy, if your cervix was preserved, you should continue getting pap smears. And also, if you had your cervix removed for due to precancerous conditions, also you should continue because it can come in the surrounding vault area. So this is a quick picture of the pap test, and it's a very quick test, not very uncomfortable. When they do your pelvic exam, it's a minute test that can really be life-saving. So that is something that we should absolutely be a part of our screening tests. Next is ovarian cancer screening. So this is a pretty deadly disease, unfortunately, because people don't really pick it up, and there's no great screening tests available for ovarian cancer. And also by the time the symptoms are caught, people are already in stage 3, stage 4 disease. Because of that, ovarian cancer outcomes are not the greatest. But if you have certain genetic syndromes like the BRCA, if you're BRCA positive or other things, or you have a strong family history of ovarian cancer, then you can take certain measures like doing yearly transvaginal ultrasounds, or also checking for certain tumor markers like CA125. And this can be very helpful, but yes, have not been proven to really save lives. So the reason I wanted to really talk a little bit about symptoms, so along with screening tests, one of the most important things is for people to be aware of what the symptoms are, because generally it is very difficult for us to make it to the hospital, and we generally get very busy with life, especially young women. So it is very important to be aware of the symptoms. We notice something different, to go to a doctor immediately and seek medical attention. So I will very briefly go through the signs and symptoms of breast cancer. A lot of times it's a painless lump. If a lump, that's why self-breast examinations are important every month. If you feel a lump is increasing in size, or it is very hard, and mostly they're painless, or if you have some change in the shape of your breast. So that's why it's important for a woman to look at herself in the mirror, both with her arms down and lifting up, because sometimes we can have things underneath the breast that can cause a little bit of skin tenting that is not only visible if you move your arm. And another common thing which I see women neglecting is redness on their breast. They think it's an infection. They start taking antibiotics, and then they say, oh, it kind of got better, but didn't completely. And they keep doing these trials of antibiotics thinking it's an infection. This actually could be a very deadly type of breast cancer called inflammatory breast cancer that can be extremely, extremely aggressive, and outcomes can be very poor. So if you have one dose, one full course of antibiotics, things are not getting better, I would definitely seek medical attention to make sure you rule out an inflammatory breast cancer. So having different size breasts, having bloody nipple discharge or even clear nipple discharge only from a single breast or a single duct can also be very pathognomonic for breast cancer. Going to cervical cancer, these symptoms can be a little vague, but it's important to be aware. You suddenly notice swelling in your arms, you have a new onset of back pain that is not getting better, pain during sex, bleeding after sex, or also bleeding in between periods, and also unexplained weight loss or abdominal pain. These are some vague symptoms, but they should grab your attention. If you have a lot of fatigue, or there's something different, or you have any change in your urinary habits or bowel habits, bleeding in both your urine or your motion, you should definitely get some appropriate help. So ovarian cancer symptoms are very vague. They tend to be like, it could be anything. It could feel like just fatigue, people losing a lot of weight or gaining a lot of weight, sudden abdominal distension, not able to, poor appetite, or pain during or after sex, and bleeding, and change in your bowel habits and your urinary habits. All these things should be something is wrong. Then you should definitely get an abdominal ultrasound and get the appropriate help. So prevention. So here we want to really talk about the things that we can do. Like we already talked about, the key for early detection is improving awareness that Grace Foundation, other important foundations are doing a great job of, where we talk about these diseases and make it open so people really know how to seek help. Second thing is really making excellent use of the screening tests available. So much research has gone into it, and it's very effective and it makes a difference. So I think, being very proactive about doing, low invasive screening tests is a huge help. And ultimately prevention, yes, there are things that you can do that will make a difference. For example, in breast cancer, yes, alcohol has a direct effect on breast cancer. Increased alcohol intake can increase your risk for breast cancer. So avoid alcohol if as much as possible. Again, maintaining an ideal body weight and staying active really decreases your risk of getting breast cancer, as well as also a recurrence, and also many other cancers are also prevented by this. So if you have chosen to have kids, then it's good to have kids early, usually under 30 years of age, and also breastfeeding is helpful. I would not get stressed about this, because a lot of women now are having kids late and also are not able to breastfeed for various reasons. Do the best you can, but there is some improvement, but it's not life threatening. So I wouldn't stress about it, but do the best you can. And as far as OCPs, yes, routine OCPs don't have a very big effect on breast cancer. They can have a little bit, but mostly it's really hormone replacement after menopause that has a greater influence on having breast cancer. So that is something, it's better not to put more hormones into our system than necessary, because most of the foods around us have a lot of different things that can be harmful. And I also want to briefly mention, if you have the abnormal genes that increase your lifetime risk of breast cancer, there is a role for doing something like prophylactic mastectomies with reconstruction, especially in the BRCA genes that you probably have heard a lot of celebrities have done. That is something to consider. That does decrease your risk from to 85 to 95%. So that is helpful. So cervical cancer can be prevented. Smoking is a huge risk, and multiple sexual partners, especially without barrier method, definitely increases your risk because of the transmission of human papilloma virus. And so always use a barrier method, and it is not the only it is not completely protective, but it really prevents to a great extent. And the most exciting thing that has happened over the last few years is the vaccination that has come out, which I know a lot of people are very nervous about giving, but it is effective. It does decrease your risk of getting the human papilloma virus. So both boys and girls can get it, because boys also can infect girls. It's not just the girls. And usually it's given between 11 to 12 years of age. There's 3 doses that you get at 0, 2, and 6 months. And even if you miss it at 12 years, you can also give it between 13 and 26. And after 26, if you have a lifestyle, for example, homosexuality, where there is a greater risk of protracting of HPV virus. So these kind of patients can consider even afterwards, or HIV patients or other immunosuppressed people can consider even after 26 years of age. So these are briefly 3 vaccinations are available, and these really protect you against various strands of HPV, and they are effective. Ovarian cancer prevention, like I said, if you have a strong family history of ovarian cancer, or you have certain cancer syndromes because you're carrying a genetic mutation, by taking OCPs, you're decreasing your risk for 5 years, you're decreasing your risk by 50%. And yes, if you have a BRCA mutation in these patients, we do offer bilateral salping or oophorectomy, we call it, where we take out both your ovarian tubes as well as the ovaries. That decreases your risk by 85 to 95%. So this is something to consider. If you have the mutation, try to have your children early, and maybe after 40, when you've had your children, you can consider doing a oophorectomy. This is a single procedure that will really decrease a disease that is very difficult to pick up at early stages. So that's it. And I would like to end this talk by really saying there are things that you can do. You can prevent this and stay on top of it. And there's great treatments available. There's no reason to feel very fatalistic about cancer.
Dr. Pratima, thank you so much. That was brief but power packed with information. I just want to remind our viewers that you will have a link for this recording and this presentation, part of the recording, in the website gracecancerfoundation.org. But Dr. Pratima, questions are just pouring in. And I have just a couple of questions before we move to Dr. Rupinder's presentation because they're a little urgent, and then we will move to Dr. Rupinder's presentation. So there is one question coming in from DV Suresh. It's a very specific question, Dr. Pratima. Should pap smear test be conducted after 5 years of radical hysterectomy? I hope you got the question. Yes.
Yes. Like I said, usually a radical hysterectomy, we do remove the cervix as well. So you would think that, but sometimes if it was an advanced cancer and they could have some changes around the vault of the vagina that we call it, where there's other cells, there could be a transformation in these cells. It is always good to go for routine tests and get the appropriate tests, and you should be in touch with the oncologist because you could have a recurrence. And Dr. Rupinder and Dr. Chinnababu, please add anything else if I missed out.
Sure, Dr. Pratima. I think the question is very pertinent. Usually, we do a stringent follow-up of radical hysterectomy for about 5 years. So, in that sense, probably I think the question has come up. So, but definitely, yes, routine follow-up, especially for any changes in the vault, can be done. But otherwise, it is not unlike a simple hysterectomy with cervix removal wherein you don't advise. So, in this case, there is no stringent rules as such as far the follow-up is concerned. But definitely, yes. After 5 years, just like any other general population, she can be under follow-up for any recurrence in the vault.
Dr. Rupinder, you'd like to add anything? Yeah.
Yes, definitely. I mean, probably the lady is trying to ask that usually after 5 years, we would call a lady cured of cervical cancer. So she's probably looking at a surveillance need after that. The standard procedure is to do an yearly follow-up, yes, and pap smear as indicated, because let's not forget that having cancer and treated for cancer is probably the most high risk, in terms of it coming back. So when you talk about cancer prevention surveillance, you definitely fall in a very high risk category if you already had cancer and you've been treated for it. So therefore, yes, usually 5 years down the line, we'll call that you're cured of cancer after such a procedure, but it's still advised that you go for your annual examination.
I thank you so much, all three of you. You have definitely taken the right cautious approach. You can never be too sure, and we should never. And I think the greatest danger is when we and people like me have this very brave and foolhardy situation that this is not going to affect me. So thank you for that cautious approach, and the annual screening or checkup is definitely useful. Just one more quick question, Dr. Pratima. Soon after this, we're going to have Dr. Rupinder's presentation. But these are some of the urgent questions coming up. There's a question which says that, okay, I've detected a lump, but what next? What do I do? Should I panic, or is there something more that I can kind of check out on my own to know whether it is serious or not so serious?
Yes.
And this is about breast cancer.
Absolutely. So that is always the biggest fear. Most of our visits in the breast clinic are usually people just with breast symptoms that they worried it's cancer. Our biggest job is really to rule out a cancer. And yes, every lump, most of the time, majority of the time, it's good to know, it's good for everyone to know that most of the time they're benign. And obviously, the chances of being benign are much higher when someone is younger. With age, the chances of that probably being a malignancy is a little higher depending on the age. So the older you are and you suddenly have a lump, probably the chances of you having a cancer is higher. But either way, unless we biopsy it, unless you're examined, you can never be sure. So the right thing to do is to not panic. Panic is never the answer for anything. There is solutions for everything. This is a very treatable disease. So you get the appropriate imaging and you will have to biopsy it and take the guidance of your doctor. So the first thing I would do is actually go to a breast specialist or a surgical oncologist and get examined first. Then you get breast imaging and then do a biopsy that is appropriate and then take it from there. And like I said, a needle test, we always recommend a core biopsy of the mass so we have a better idea of what exactly it is. It'll give us a better chance to rule out cancer and give complete information with more accuracy. Yes.
Thank you, Dr. Pratima. Dr. Rupinder or Dr. Chinnababu, anything to add?
No, I think it is
I think.
perfectly summarized by Dr. Pratima. The only assurance that I want to give to is especially young women between 20 and 40, most of the time the lumps what you feel could be fibroadenomas. Out of 10 lumps, 8 are benign fibroadenomas. But again, as rightly said, breast cancer can be seen in even young people, especially in India. The breast cancer onset is 1 decade earlier compared to the West. So given that, we should not ignore, but at the same time, there is no reason to panic.
The only thing I would like to add is that often I see patients come and tell me that there was a lump and it wasn't painless and we didn't bother about it at all for a long time. So my word of caution here is lumps that are not painful, that are not bothering you, need more of attention. A lump that's painful, cyclically painful, I mean, that's more likely to be benign breast disease, what he just mentioned. But caution is that a lump that is not painful, that's, been there, now increasing in size, that's the lump that we are looking at for early diagnosis. So see your doctor if you have a lump like that.
Thank you so much, doctors. I mean, the message is loud, and why there is good news that 8 out of 10 may be benign. But then once again, you're requesting don't self-diagnose. Go and meet a doctor. Don't second guess, and don't go by what your friends and others are telling you. Thank you very much. We'll go over to Dr. Rupinder now. Dr. Rupinder has a brief presentation too. Doctor, I just wanted to ask, it is Sunday evening, and where exactly are you located? I believe you travel Delhi, Chandigarh often. Where exactly are you located today?
At home, at sweet home. I moved back from Tata Memorial back in 99 from Mumbai, and then my base has been my hometown. This is Yamunanagar in Haryana.
Okay.
And we have a cancer wing here in our hospital. And apart from that, I'm visiting consultant at a number of hospitals.
That's
so
wonderful.
Today, of course, it's on sweet home.
We're so privileged to have you with us, and it's over to you and your presentation.
You've had a nice, lovely presentation about female cancers. Now let's talk about a cancer that's, of course, only in the males, a prostate cancer. So I'm going to be a little androcentric. Prostate cancer is interesting as far as screening and surveillance is concerned. In terms of screening, it is a cancer of the elderly as we normally see it. Age being the most crucial factor in terms of the outcome of this cancer. Prostate cancer presenting at an early age, probably younger than 70, is going to take a completely different turn. And if you have a prostate cancer at 75 plus or 80 plus, even if you don't treat you're unlikely to die of prostate cancer. So here is a cancer where screening is important, but screening is important if you've had a history of prostate cancer in the family, your close one, your brother, your father, one of the close uncles, somebody has suffered from it. In that case, we're looking at screening for prostate cancer earlier, maybe around 50. And screening would typically stop at about 75. And we don't usually, there's no cost benefit of screening a patient after 75. So, I would generally say that screening for any cancer for that matter is important if our early diagnosis is going to change the outcomes. And we have typically two outcomes. One is disease-free survival, and the other is in case we can somehow make sure you don't die of that cancer. So in terms of prostate cancer, if you look at the cost benefit and that the final prevention of death by prostate cancer, So there are many studies that show that maybe there is not much of a difference in terms of the final outcome as far as death is concerned from prostate cancer. But definitely there is an advantage in terms of treatment and a disease-free survival with good quality of life. So in terms of prostate cancer, a very simple blood test is used for screening, and that is PSA, prostate specific antigen. Simple blood test, doesn't cost much, and is easily and widely available. Can I have the next slide, please? So PSA is a very, very simple, easy test, requires no fasting. You can walk into any lab and give your test. Typically, we do a total PSA estimation for screening, and we would also, in certain cases, recommend a free PSA and then see the ratio of the two. Now, PSA, if it is less than 1, I would say just don't bother. You could get a test repeated 2 or 4 years down the line. If you belong to a high-risk category that I just mentioned in terms of your family history, in that case, you could look at an annual PSA examination. As long as it's below 1, do not bother. Between 1 and 3, there is caution. And in that, I would say that you get the reports to your oncologist or a urologist and let him interpret that report for you. Because PSA would, of course, depend on a couple of things. It would depend upon the size of the prostate. It would also depend upon, your drug history. Supposing you're taking drugs for benign prostate, that will reduce your PSA levels, and that will not be a true reflection of a cancer developing in the body. So between 1 and 3, let your clinician take a call for you. 4, between 3 and 4, you need more caution. 4 and above, definitely you need to see a doctor and discuss having a biopsy maybe. And on higher levels, sometimes you might find that you have a crazy figure like 20, 25 out of the blue. And your clinician is even surprised that how come it's so high. In that case, a free PSA comes in very handy. So there's a total PSA and a free PSA, both done on a simple blood test. And then you look at the ratio of the two. Supposing the free PSA is low, less than 15% of the total PSA, then again there's a caution. There's a greater chance of it being cancerous or malignant prostate, and accordingly you must seek help. But if the free PSA component is extremely high, then it's likely to be a benign prostate. This can happen in situations where you have infection in the prostate, like prostatitis of some form or the other. Sometimes you have a crazily high figure of PSA and you find that patient had a small abscess or a pus in the prostate. So the thing to remember here is PSA is a simple blood test for screening, but to be interpreted with a lot of caution. Screening by PSA has a plus and minus sides, pros and cons to it. In elderly, sometimes a high PSA would cause an unnecessary panic. They need a lot of reassurance. So just getting a test done when you don't have facility for good counseling, good guidance, could send you in a panic mode completely. So we would recommend surveillance or screening where the facilities are definitely available. You have an access to a specialist in case the values are high. Getting yourself self-tested and then going into a panic mode, not a great idea. I would tell you one thing for sure, that in cancer, one needs a balance in approach towards cancer. Not every cancer will kill you, and not every cancer will be cured. The truth is between the two. While it's good to be aware, but some people are blissfully ignorant, and that's probably the best for them. And that would be true for somebody who's maybe at 70, 75. So in most centers now, they recommend do not routinely check PSA after 75. Even if the patient has prostate cancer, we make an early diagnosis, it is not going to change the final outcome. Unlike my previous speaker who discussed about the advantages of early diagnosis and treatment in all gynecological cancer, prostate cancer is a little tricky that way because it may run an extremely indolent course where it will remain confined in the capsule of the prostate and never come out of it, and maybe, almost behaving like a benign local enlargement of prostate. So it can run that kind of indolent course. And for such people, sometimes the treatment that will be offered will have far greater side effects than the disease itself. So that's where it's slightly different, and I wanted to stress that point. I was also asked to say a few words on the colorectal cancer. Colorectal cancers typically come to us quite late in the stage of the disease, and the outcomes are not brilliant. We have great remedies, but unfortunately, we see patients at a much later stage. A very simple test that I would recommend is people who have high risk, in the high risk category, who've had cancers in the family. There are associations of certain genes being, responsible for some cancers now. So if any of those factors are there, of course, surveillance is recommended early. In case you've had a bowel disorder like inflammatory bowel disease, you need surveillance early. Other than that, we are typically looking at 50 plus is the age when you're looking at surveillance for colorectal cancers. And there a simple test is a simple stool test, and you're looking at an occult blood, and that would really help in the diagnosis. In a typical Indian scenario, I can tell you, Indians are a little different as far as bowel disease is concerned. And typically, I can call them as bulk eaters and bulk shitters. So this is completely different from the Western lifestyle, where you have people who are eating lots of meat, lots of animal fat. The bowel habits are completely different. Indians that way are really different. So for an Indian, probably it should be easier to pick up colorectal cancer in early stages if you just pay attention to the altered bowel habits. I think it's an awareness that something is wrong. I don't feel like eating the way I used to. There are constitutional symptoms that come in, and we keep on ignoring them. You have a little bit of constipation, and typically constipation is a bowel habit that is different for you. There is no other definition to it. And because you have people who will probably pass stool twice a week, and there'll be people who will go 3 times in a day. So it's something that has changed for you. And then instead of just, having Kanchurans and going to, trying all the grandma remedies at home, it would probably be a great idea to get a simple test done on the suggestion of a doctor, preferably. It's a simple stool test. You can also get a simple blood test done, what we call a CEA. Now, with all those markers, as it was with the PSA for the prostate cancer, or be it CEA for this colonic cancers, they're not very, very sensitive. You could still have a cancer and have a normal marker, both PSA and CEA. And you could have these markers going up for other reasons, like explained in the prostate cancer. So you don't have a definitive marker like this, but this would definitely encourage you to get a colonoscopy done. Colonoscopy could be either an invasive test where a doctor is going to put a tube into the rectum and right up the colon and see from inside what is wrong. It would also help you probably diagnose other reasons for which you probably had some kind of discomfort and you needed attention. So that is one investigation. However, it is invasive, sometimes calls for anesthesia, carries its own risks. So now the modern science has come up with something more interesting. And there are centers that are doing a CT scan colonoscopy. Now that is non-invasive. Yes, it calls for good equipment. It calls for an expert radiologist to interpret it, but that option is definitely available today in most major cities. So that is a non-invasive way of looking at your colon. There are other tests available. I will not dwell into the kind of a detail, but I would just say that early diagnosis of cancer would definitely help in terms of colorectal cancer. It will definitely increase the disease-free survival, probably cure rates, and there is no doubt that you must be sensitive towards changes in your own body. I mean, that's the best thing I can tell you. Your body always tells you, well, there is something wrong. And often we ignore it long enough that we have to repent later. So that is the most important thing in terms of screening and surveillance, sensitivity for your own body. And with my experience in oncology spanning over more than 3 decades, I can definitely say one thing for sure, that keep your vitamin D3 levels normal. There is enormous evidence pouring in today that deficiency of vitamin D leads to abnormal cellular changes, and in a way, it predisposes to cancers. And this is one thing that we all should do. Traditionally, Indians used to love sunbathing. The culture was such that we would all probably sit down in a common courtyard, chit chat, talk, be stress free, get lots of sunlight. It just changed. And we now only know that Europeans are doing sunbathing. Unfortunately, it's the deficiency of vitamin D3 in the Indians that are leading to tremendous increase of cancer now. So that is one thing which is preventable, which was part of our culture. We always treated Surya Devta as the father. And time to go back into our Vedic times, learn something from our culture. Instead of doing a piecemeal screening, strategy, one for gynecological cancer, one for colorectal cancer, one for PSA, I would also recommend that you must get your annual examination done. Some of the common tests that we do in an annual examination, like maybe an ESR, as simple as that, maybe a CRP, they would all tell there is something wrong inside. Time to have a look inside, and if you seek help in time for basic changes that are happening in a body, then we don't have to do a piecemeal screening strategy that we're talking of. After all, it's one human body. So that is where my emphasis would be. Be sensitive toward what your body is telling you. That is most important. There is an innate sensitivity in our body. It's got a surprising kind of intelligence, which is probably beyond what our modern medicine can talk about. Just listen to it. That'll be great. Thank you.
Thank you so much, Dr. Rupinder. Wealth of information. I like that part which kind of encapsulates everything which everyone is saying, that is, be sensitive and listen when your body is speaking to you. And also about the sunlight and our deficiency of vitamin D3, as well as many other valuable things. I want to tell you, 3 of you doctors, the questions are pouring in. I will just start, if you don't mind, with just what you said at the beginning, Dr. Rupinder. And here's a very specific question again. It says, what do you recommend to prevent occurrence of prostate cancer for a person with symptoms of slow urination? I guess you would understand that term. symptoms of slow urination, what would you recommend to prevent occurrence of prostate cancer? This is to you, Dr. Rupinder.
I can't really say that there could be one-step prevention for prostate cancer. Like I said, cancer is a multifactorial disease. If you have a slow urination, probably your prostate will increase in size, and it's likely to be benign than anything else. Like I said, a simple PSA test would help tell us where you're likely to go. But I mean, all you can do is, like I said, keep your vitamin D3 normal. Easier said than done, but stress plays a big role. You can keep good nutrition. Curcumin is coming up in a big way for prevention. You're looking at a lot of food items. You're looking at broccoli in breast cancer coming up. People are talking of that. Basically, eat healthy. Whatever you eat today is going to be part of your body tomorrow. So the Vedic wisdom was that man is what he eats. And today I understand what it means. So everything that you eat is going to be a part of you. So eat healthy, live right. That is universal for all cancers. Apart from that, if you specifically ask me prostate cancer, I would only stress that there's enough evidence that chronic prostatitis, chronic infections in your prostate can lead to cancer. So try and check that. See a urologist, see a doctor, make sure you have an infection-free prostate. That's one thing that you can definitely do to prevent it.
Thank you, Dr. Rupinder. Very valuable, of course. Dr. Chinnababu, one quick question for you. A couple of questions revolving around the role of hereditary factors in cancer. And if you could just demystify that aspect for us, how much should be worried about from the hereditary point of view of cancer? If you can just take that up.
Sure, Pramod. If you look at the overall incidence of cancer and what percentage of them are hereditary, it is pretty low. So 85 to 90% of the cancers are sporadic. That is all, most of the time they're related to our lifestyle or so many other multifactorial. But about 5 to 10% are hereditary. So in that sense, it is a much lesser percentage of the cancer disease, which is hereditary, need not be really too much concerned. But again, what is most important is your family history. What percentage of your first degree relatives, when I say whether your mother, your sister, or your daughter, or even in your siblings. So what exactly is your personal history that would help us to decide the risk that you may be having. But prima facie, hereditary is not something that you need to be unduly worried. Moreover, you cannot change the hereditary part. Only thing is you can pick it up a little bit early. So in that sense, the family history would definitely give us more insight to decide whether you would require any screening early. Usually hereditary cancers, if it is running in the family, then the near relatives would undergo a screening about 1 decade earlier. So suppose your mother had a breast cancer at 50, you would undergo screening for breast cancer at 40 years. So that's how you take 1 decade as a margin before you start the screening.
Thank you, Dr. Chinmabu. We'll move on to the other questions because now, in a typical cultural way, we are late starters, but so many questions are coming in towards the end. Dr. Pratima, this question is for you. You have, in a sense, answered this, but I think there'll be great value in re-emphasizing. The question is simply this. My sister had a lump in the breast 1 year back, and it's removed by surgery. Now, recently, she found again a lump in her breast. What is the course of action? Kindly give a suggestion.
So over here, what is important is the lump that was removed. What was the lump? If it was a benign lump, for most commonly, I don't know the age of the person, but usually fibroadenomas are common. So people who have one fibroadenoma tend to have a lot of them, and usually they can happen in both breasts. So every single fibroadenoma does not need to be removed. If it is over 4 centimeters, between 3 to 4 centimeters, we recommend removing it. If they're very, if that is making the person nervous, we recommend removing it. But usually, and also if it is increasing more than 0.5 centimeters every 6 months, we would remove it. So not all fibroadenomas need to be removed. They can be just watched.
Thank you so much, Dr. Pratima. Panelists, this question has come with a request, a rider to this question saying, kindly give the answer in Hindi. So I would request who of you, apart from your brilliance in oncologists, if you're multilingual and you're good at Hindi, this question is for you, doctors. Guru Prasad ji, आपने पूछा, आपने सवाल दिया है और हम रिक्वेस्ट कर रहे हैं कि there will be a mixture of English and Hindi so that more people will benefit from this. The question is simply this: what type of cranial irradiation based prophylactic therapy combination? Let me just read it again. I may have got confused. What type of cranial irradiation based prophylactic therapy combination can dramatically improve the survival of patients with extensive small cell lungs cancer? Dr. Rupinder, would you like to take that? I'm just making an assumption
I'm
here
not
that you would be the
really
most.
sure what,
Yes.
what
The
I'm
question,
not
yeah.
really sure what exactly he's trying to ask for the small cell lung cancer. Come again?
Yeah. I know it's a long, complicated question, but we'll just try again. If not, we'll have to connect offline with the person I don't know. But what type of cranial irradiation-based prophylactic therapy combination can dramatically improve the survival of patients with extensive small cell lung cancer?
I think if they're looking at
Yeah, go
some
ahead, sir.
form of radiation for this small cell lung cancer, I think is that what he's trying to ask? क्वेश्चन बहुत इंग्लिश में और मेडिकल लैंग्वेज में पूछा गया, जवाब वो हिंदी में चाहते हैं शायद। इसलिए शायद मैं ये कह सकता हूँ कि स्मॉल सेल लंग कैंसर के अंदर प्राइमरी मोडालिटी जो है वो कीमोथेरेपी हम यूज करते हैं, जिसका मतलब है दवाइयों से कैंसर का इलाज करना। रेडिएशन का एक एक्सटेंसिव लंग कैंसर के अंदर रोल कम है, बिकॉज रेडिएशन जो है वो नॉर्मल लंग टिश्यू को भी बहुत डिस्ट्रॉय कर देगी इस सिचुएशन के अंदर, और जो हमारे एल्वियोलाई हमें एक्सचेंज ऑफ ऑक्सीजन के लिए चाहिए वो ही नहीं बचेंगे और रेडिएशन के बाद अच्छे, तो फिर हम कहते हैं ना जैसे एक पेशेंट जो है वो ऑक्सीजन पे निर्भर हो जाता है, ही इज अ क्रिपल एंड वुड प्रोबब्ली नीड टू कैरी हिज ऑक्सीजन सिलेंडर एवरीवेयर। सो रेडिएशन वी यूज सिलेक्टिवली, वी यूज फोकस्ड रेडिएशन, बट जहां पे एक्सटेंसिव जैसे ये बता रहे हैं लंग के अंदर स्मॉल सेल कैंसर है, उसका रोल जरूर है। इट कैन मिनिमाइज एंड प्रोबब्ली गिव लिटिल बिट लॉन्गर सर्वाइवल, बट नॉट अ ग्रेट मोडालिटी इन टर्म्स ऑफ क्योर। उसको इलाज करने के लिए हमेशा के लिए कोई अच्छी मोडालिटी नहीं है। इसके साथ में पेशेंट का कुछ समय अच्छा निकल सकता है। आई होप आई आंसर्ड इट।
Thank you so much, Dr. Rupinder, for trying. Friends, we are taking just one more questions from the question that has come to us. And after that, I have my question, a very curious question to Dr. Chinnababu about the role of fitness in cancer prevention. And why exactly are you putting in so much effort for this Grace Cancer Run? But I'll come to that later. Now, this question is from Chirjeev Chug. Chug साहब ने पूछा है, when should we start taking this vitamin D? And this was obviously as a response to what you had mentioned, Dr. Rupinder, but anyone could answer. When exactly should we start taking this vitamin D?
Vitamin D, I see now pediatricians starting very, very early. I mean, something like within months of birth, you know. And sometimes I even see it's abused now. I come across kids with very, very high dose of vitamin D. And vitamin D is toxic for the kidney. So please remember that it's a fat-soluble vitamin. It's toxic for the kidney also. And very interesting, I've come across some patients who actually have landed up with kidney issues, kidney failure on high doses of vitamin D. So that is the first caution I want to tell you. Vitamin D supplementation, if you're going to take, it must be after you've tested your vitamin D. We give you, prescribe an X dose for it to get your level within the normal range. And then we would recommend, depending on your lifestyle, what dose you must take to maintain it. Also, there are two types of vitamin D available, the fat soluble and now a new generation water soluble vitamin D is also available. The dosage would differ. So please consult a specialist, doctor. This is one vitamin that must be taken strictly under medical supervision. And the other thing to remember is that you have a natural source for it. Your skin can generate
Yes.
enough vitamin D from sunlight.
Sunlight.
However, the time needed to generate would depend on the color of his skin. A white man probably can start making vitamin D in 5 minutes of exposure to sunlight and probably would have made sufficient vitamin D in next 10 minutes. Typically, a darker Indian skin might require 30 minutes to 45 minutes to start making vitamin D, and you might need a sustained exposure of a large part of your body directly exposed to sunlight for at least 40-45 minutes to make enough vitamin D. So please remember, sunlight is the best source. Time of exposure depends on the color of your skin. If we are looking at correcting it once with medical therapy and then maintaining it with sunlight, then this is the way to do it.
Thank you so much, Dr. Rupinder. That was so insightful. Thank you so much. Grateful to you for these insights. Dr. Pratima, before we go into to Dr. Chinnababu, would you like any closing comment, a quick one or two liner would you like to say before we hand it over to Dr. Chinnababu?
The one thing I would like to say is there is a lot of, breast cancer is the #1 cancer right now in the country. And there's a lot of negative publicity about mammography and screening, and people are very confused about what they should do about it. Yes, government-run screening is not possible in India, but screening does help. Mammography does help. It has shown to save lives. So opportunistic screening, if you can have a doctor, reach medical care, you should be proactive about screening regularly, getting tests regularly, being aware of the symptoms, because these cancers, when caught early, will definitely improve survival. And stage 1 and 2, people have an almost 90 to 80% cure rate in 5 years. So you can help yourself, and you should.
Thank you so much, Dr. Pratima. Very valuable as always. And Dr. Chinnababu, what is the connection, the wisdom behind this Grace Cancer Run? And what is the connection with cancer?
Well, Pramod, I think most of us would agree that physical activity is very important, not only for non-communicable diseases like diabetes or hypertension or cardiac, but also for cancer. So various researchers have shown for sure, especially for colon cancer, there is about 40 to 50% reduction of colon cancer. There is about 30 to 40% reduction for breast cancer. Similarly, for uterine cancer and lung cancer, there has been a benefit of physical activity. So overall, if you're physically active, you would not be having much of a excess fat, and hormonal imbalance would not be there. That's how it would be very much protective. So in that sense, for prevention of cancer itself, we are looking at a physical activity of close to 3 hours per week at least. That would go a long way in preventing most of them. So we all know prevention is better than cure. So even before screening, even before the disease begins in you, if you have a healthy lifestyle, we can prevent cancer. So I think the lifestyle is the biggest risk factor for cancer. So if you look at one reason why the cancer incidence is increasing today, it is our lifestyle, the stress. So physical activity goes a long way, in reducing the probability of you getting cancer. So that's the reason we have come up with this, the 3rd edition of Grace Cancer Run on 10th of October. This is a global event. It's a virtual run. People can do it at the comfort of their home, in their backyard, in their terrace, in the treadmill, wherever they are comfortable, they can do that. And we're just trying to pass on the message that, be physically active. You can conquer cancer and many other non-communicable diseases, and it will do a lot of good to you. So that is the message that we're looking at through this the campaign that has begun, more than a month ago.
Thank you so much, Dr. Chinnababu. All the panelists, Dr. Rupinder Singh, Dr. Pratima, Dr. Chinnababu, we are so grateful to you because we can see in you a passion to just eradicate this dreaded name of cancer from our dictionary. And we can see that, friends, there is an urge to you that you join this movement, this Grace Cancer Run on the 10th of October. You'll have the details on the screen once we close. And if not, go to gracecancerfoundation.org. And we want to see you there. If not for yourself and more than yourself, to spread this movement of fitness and making sure that our lifestyle itself is in a manner that we can eradicate this disease. Thank you so much, panelists. And thank you, all of you, for your patient listening. You'll have the recording of this in the website, and all the best for you. Have a lovely day wherever you are. God bless you.